Hello there, this is Dr. Lisa Shiver, and we're going to discuss prioritization. All nursing interventions can be placed in one of four categories when we're considering priorities. They are first order needs, second order needs, third order needs, and fourth order needs. If you can learn to place your interventions into one of each of these categories, this will really help you tremendously in setting your priorities for your patient care. Your first order priority needs involve those threats to immediate survival, and we know those threats as being airway, breathing, circulation, but also safety is considered a first order priority need. This requires immediate intervention, and if we don't intervene, the patient's condition is going to deteriorate. Examples of first order needs: patients about to fall, patient with an obstructed airway, or patient with a heart rate of 24. If we don't do something soon, we're going to have some major problems. So all of those are considered first order priority needs and always will be addressed first. With our second order priority needs, these are problems in which the patient or family have asked for help. It's something that's concerning them. It might be something like a gown change or wanting their linen changed on their bed, but it's important to them, therefore we place it as a second order priority needs. If we fail to meet these needs, their confidence in us as the nurse and our rapport, our patient nurse rapport, is also going to be in trouble, and that makes providing care very difficult. Examples of second order priority needs include patient complains of pain, and that's probably one of the more common ones we're going to see. Nausea, they want assistance with their ADLs, which are their activities of daily living, or maybe they request help to the bathroom. Maybe they want their gown changed. Anything that's important to them or they have requested is a second order priority need. Got a hint down here at the bottom, and this is pretty important. These may not seem as urgent to you as the nurse, but you always will place these needs right after first order priority needs. You always do for the patient first. Your third order priority needs, these are actual or potential problems that are unrecognized by the patient or family. So these are things they're not even aware of that are going on. They also require close monitoring by us, the nurse, and they could be things like side effects of a drug they're taking, abnormal lab values, maybe the patient's potassium is low, complications of a disease or treatment. If the blood pressure is high or the blood pressure is low, the patient may not be aware of that, but it's important to us as the nurse. So any of these actual or potential problems that are unrecognized by the patient or family, we are going to place as a third order priority need. Our fourth order priority needs, these all involve future planning, the key word being future. Often it involves patient-family teaching. It may be actual or potential problems that we're dealing with. Some examples: discharge teaching, how to care for themselves at home, might be related to diet, medications, how to prepare, administer insulin, getting social services involved to make sure they have the things they need when they're discharged. So any of those have to do with future being the key word. Those all fall under fourth order priority needs. Frequently will involve some form of teaching. What we need to keep in mind is the less time that you have to intervene, the higher the priority is going to be. Okay, so if you can remember that, that may help you set your priorities as well. But to review, our first order priority needs, those are the emergent, the ABCs and safety. The second order priority needs, these are patient or family concerns, complaints, what's important to them. Your third order are going to be things that the patient or family are not aware of, such as the blood work, results, things like that. And then the fourth order priority needs are related to future planning and teaching. The reason we have to go over all this is we have to consider and prioritize our patients when we're providing care. That also will help us with delegation and deciding which patients may need which staff to help care for them, and we'll talk about that in just a minute. So we need to know the needs and priorities of each individual client. And how will we know that? Well, that we get usually early in the shift. During our change of shift report, we should get some indicator, at how critical our patients are, or how stable our patients are, so we can set priorities and know who we can assign to who, or who would need immediate care. Also, your initial assessment. Your initial assessment is so critical. Once you receive that AM report, or that report, the change of shift report, you need to go at least look at your patient and make sure they don't have any immediate needs. A lot of nurses will wait, and time goes by, and they can really get in trouble. Your patient may get in trouble during that time. So go look. Make sure you put your eyeballs on your patient, as I tell the students, and make sure they have no immediate needs once care has been turned over to you. Your initial assessment, whether it be a focused assessment or a full assessment, we'd like to start with a full assessment where you do a good head to toe. That will also give you a lot of information and help you set your priorities. Depending on the number and the qualifications of the staff and the acuity of the patients too, you can help delegate. And we're going to talk a little bit more during the roles lecture about LPN's role and the RN's role. But just as a refresher, LPNs and nursing assistants, they need to be assigned patients with simpler needs. The patient's predictable, everything's going as planned. They need less complex nursing services. Those patients primarily are going to be assigned to the LPNs. With patients who are more complex, or we have an unpredictable situation, they need more frequent assessments, more complicated interventions, or even more frequent interventions, that's when the RN needs to be assigned to that patient. But we'll talk about roles and delegation in a different lecture. We also will practice some prioritization when I see you in class.